at 31.09 US cents per pound. September soy meal is unchanged at 293.80 per hundredweight. Corn futures are slightly higher on Friday morning, with the December contract up a penny at 3.40 per bushel. Chicago oats are lower, with the December contract down 2.5 cents at 2.61 per bushel. Wheat futures are lower on Friday morning. Chicago December is down 4 cents at 5.25. Kansas City December is down 3 at 4.49.5, and Minneapolis December is down 2.5 at 5.25. That's a look at the ICE futures and the Chicago markets for Friday morning, August 21st. For Markets Farm in Winnipeg, I'm Glenn Halleck.
There are no such things as small chores on your farm, so you need equipment that works as hard as you do, especially during harvest season. That's where New Holland and Butler Farm Equipment in Fort St. John come in. During New Holland Harvest Days, get terrific deals on equipment to help you work more productively. Save with 0% financing and cashback offers on select tractors, hay tools, and harvesting equipment. Stop by Butler Farm Equipment in Fort St. John today for details. But hurry, Harvest Days ends September 30th, 2020.
The opinions expressed during this show do not represent those of this station. If you've missed any of this show, you can follow the podcast at energeticcity.ca. Now, an in-depth look at the news and information shaping our community. This is Moose Talks with your host, Doug Craig, on Moose FM.
Greetings and salutations. Welcome to Moose Talks. Later, we'll be chatting with local musicians Naomi and Joseph Bulte about how the pandemic has affected their work as gigging artists and how the near future is shaping up for them. We're going to have Adam Wynn on, but he does send his regards. But let's start now with an update from Northern Health about the spike in COVID-19 cases in the Northeast. We're going to talk about masks. We're going to talk about a few things. We've got Dr. Jong Kim, the acting chief medical health officer for Northern Health on the line. Good morning, Dr. Kim. Thanks for joining us.
Thank you so much for the invitation.
You're very welcome. Well, there's been a spike in cases in the Northeast in recent weeks, a lot of them connected to this religious gathering in Deadwood, Alberta. What's interesting to me is the contact tracing part about this that found that there was several more of these cases of people who visited Deadwood at that gathering. Can you give us an idea about how contact tracing works and how it kind of came together so quickly in discovering that there were this many cases in Fort St. John?
Yeah, thank you very much. In terms of the contact tracing, for the most cases, we're starting with a confirmed case, and we get the history from that the case person about who he or she has been in a close contact with that might be at the risk of getting the COVID-19. Then we follow with those identified close contact directly and assess them for their exposure, and can implement measures like self-isolations and kind of monitoring. When there is a kind of potential kind of a gatherings or potential site kind of involved, then we try to have a more focusing on those site or events, like contacting the organizers, try to get the list of the peoples. And if we still have any remaining concern that there might be a kind of more people in the public might be exposed to the events, then as you can see that we send out that public notification of that potential exposure.
Okay. Now, is there a case number that kind of tips the scales on sending out that public notice? Because before that, generally, due to privacy reasons, as stated by Northern Health previously and the BC kind of health ministry and whatnot, you've been close-lipped about when there are cases and where. They'd say in Northern BC it's this many, but we didn't know if they were in Fort St. John or Prince George or Fort Nelson. But this was very specific. Was there, it's this many cases, now we need to say it, or was it, as you say, there's a risk, so we want to say anything? What kind of made that situation happen, made that decision come to a point where you have to do it, I guess is what I'm asking.
No, thanks for asking. You're correct that the Northern Health is keeping with the principles of a kind of privacy, as well as protecting the people in our kind of community. So previously, we've been kind of fortunate that we haven't been in a situation that there was a kind of outbreak in a community or facility that require kind of wide out kind of communications. And the reason for communicating out is driven by the risk. And for the case and contact, as mentioned, we follow the individual at risk kind of directly. So anyone at risk, we contact and follow with them. If there's a concern that more people than we actually identify as contact might be at the risk, might be those involved or attended at the events, then we kind of notify about that kind of events to the public. Or if there's a community kind of level risk, as you see in the Haidagwai, then we notify at the kind of community level.
All right. Now, you notified us that there's a risk. I mean Northern Health. I want to talk about masks a bit here, because I know Adam and I were talking a few weeks ago about having an update from Northern Health and saying, well, there hasn't been a lot of case activity up here, so masks, these sort of things haven't been as instrumental as they say have been in the Lower Mainland, for example. Then this happened. So this debate has been going on basically through this entire pandemic about the usefulness of masks, and governments have generally been pretty hesitant about making them mandatory in municipalities and on a provincial level in BC. I guess my question is, first of all, can you explain to people who don't know or are sort of confused with the debate going on, the efficiency of wearing a mask? Why should we consider wearing a mask when we're out in public when social distancing isn't possible?
Yeah, thank you very much. One of the kind of first thing we emphasize when we talk about the mask is that what you need to be doing before you actually considering wearing the mask. So you mentioned the physical distancing. It's very important. Like if you are sick, then stay at home and call your family doctor or the Northern Health online clinic to get assessed. That's very important. Good hand hygiene, very important. Respiratory etiquette, very important. And safe gathering, that kind of sticking with the people that you know, and try to keep it in the kind of smaller numbers. And again, even in the gathering, try to keep the distance. And so all those measures are important, and we need to do that before we talk about the mask. Then when it comes to the masking, the reason we are kind of emphasizing those measures before we get to mask, because masking alone, it's not very protective. It's only effective when those other measures are already taken. Then you consider adding the mask. Then it can be part of that package of effective measures. But the masking alone is not considered as effective. The main concern is that the one part is that the concern about the filtrations. That especially the non-medical grade mask is not really designed to filter the droplets where the COVID-19 virus can spread through. And second consideration is that the mask is one thing, but masking as a kind of activity is another thing, and how effective it is. Because oftentimes, mask to be effective, you have to put it on right, and you have to keep it on right. With the tight seals, and you have to keep it on when you're talking and interacting with people, and you have to take it up right, so any droplet and so on that contaminate mask is not getting onto you. And it's quite difficult to do that right, like just putting it on right, keeping it on right, and taking up right. So when we actually look at there's a limited evidence in a community setting, how that non-medical grade mask is effective. And right now, we're not fully assured that the mask need to be prioritized. At least we really want to emphasize those physical distancing, staying at home, and safe gathering and so on before we're talking about wearing the mask.
Okay, so in the case of where we're at now, where there's a risk to the community due to the number of cases that came out of that situation in Deadwood and beyond, I mean, is this wouldn't be a thing where you'd say, okay, now we need to wear masks, is to be more, okay, now be more vigilant about when you go out and who you're with and making sure that you're washing your hands and staying physically distant. Is that sort of the focus then, is keep doing those things and maybe do them more because there's a risk where there wasn't as big of a one before?
Yeah, exactly. We are seeing the increased number of cases, and many of those cases are associated with kind of a cluster at the social gathering setting. And although at the provincial level as well as the northern health level, like our daily numbers are similar to what we've seen in a March and April kind of a peak, but situation is kind of different because we're doing more tests, and the smaller proportion of those tests are coming back positive. And right now, as mentioned, we have more of that clusters, like index case and the contact around the social gatherings. Part of that is actually the more rigorous investigation around the contact being done around the social gatherings. So we're not considering that the measures that we do as a community have failed, leading to the increase in numbers. The measures are effective, and the increased number indicating we just need to do that right. Even like in the Northeast, like thinking about that gatherings and so on, the key way to reduce the transmission in such events it's not to actually wearing the mask, but if before considering the wearing the mask, it's about that if you're sick, before you go into gathering, stay at home. If you're organizing the gathering, ensuring that you limit the number, ensure there's plenty of physical distancing, good hand hygiene can be taken, and all those protective measures can be taken there.
Okay. You brought up testing, and I'm glad you did because I wanted to chat a bit about that. Testing has changed, at least very quickly at the start of this. I wanted to kind of an update on how testing is going. How quickly can we do it now in the Northeast when before we had to send the test away? It would take a few days. The turnaround time has increased quite a bit, hasn't it?
The turnaround time, thank you, has improved quite a bit. Like one part is that the transportation down to the lower mainland have improved. Like we have a flight daily kind of going down there to improve that. Second thing is that now as a Northern Health in Northern BC, we have a more local testing capacity. Like each of the kind of major site in the Northwest, Northern Interior, Northeast has a lab that can do the testing like on our site. So it can further decrease turnaround time. As we are seeing kind of an increased number of cases and people are more aware, and also we are going into flu season, we're expecting that more tests will be done, and so it's likely to lead to kind of prioritization depending on. So like those local sites in the Northeast and Northern Interior, Northwest are where we can get the most fast turnaround time. And depending on how the situation going, we might prioritize those people who are sick in the hospital.
I see. Okay, so that flight is sort of if you have more, you send it to the lower mainland.
Yeah.
Is that the idea?
Yeah, and ensuring that our turnaround time with the transportation and assessments, it's still within that 2 to 3 days.
Okay. And the test itself, has it changed a lot? Because again, I mean, you see lots of stuff online about what the test is. Is that changed? Can it be done faster and by your own doctor now, as I understand it?
At this point, we are still kind of it's a same type of testing.
Okay. And
for the test to be done right, like it needs to be collected right with the person who has the right technique, as well as wearing the right protective equipment, because he or she will be collecting a sample on a symptomatic person and sent to be transported to the lab, right? And then lab need to have experience and technical skills to actually do the testing right. So we now more physicians are kind of trained and have equipment and ready to do testing his or her office. But we are ensuring that the testing collection and testing kind of analysis is done at the right place.
Okay. And one final question for you. People have been talking about this as well. I know we've talked about it around the office here. We're coming up on cold and flu season. Is there an effective way to tell the difference between whether you have maybe a cold or the flu, or if you perhaps have COVID-19 and therefore should make the call to set up an appointment or ask the advice of the nurses on the hotline? Or are they kind of similar in sort of how they look and feel? And so are we going to be testing a lot more as a result of that, because the flu and COVID-19 kind of feel the same and look the same when you look at a symptom sheet?
That's the last approach. Like if you come with the influenza-like illness, like consider both influenza and COVID-19, it's likely the approach we've taken. It's difficult to distinguish them clinically. And clinical management of the influenza, which involve antiviral, and the clinical management of the COVID-19, which is symptomatic management, doesn't conflict with each other. It's very likely we kind of co-manage influenza and COVID-19 and do the assessment until one or the other is ruled out.
All right.
So yeah, it will likely lead to the increase of testing for COVID-19 and flu.
Okay, and would you say Northern Health, you've sort of talked about it already, you're prepared for that to happen, I assume?
That is exactly what we are preparing as a Northern Health as well as at the provincial level.
Okay. All right, Dr. Kim, I really appreciate you taking time to talk to us today and give us an update on that. Thank you very much.
All right, thank you.
All right, that was Dr. Jong Kim, the acting Chief Medical Health Officer for Northern Health. We'll be talking to Naomi Shore and Joseph Bulte right after this on Moose Talks.
Hockey season is back at Tim's. Time to turn those work-from-home beards into playoff beards and start collecting Tim Hortons' new NHL Superstar Collectible Sticks. You can collect all 6 while supplies last. Oh, baby. Not valid on delivery orders.
The City of Fort St. John and Napit Industries would like to advise the public that 100th Street will be closed at 96th Avenue until October 1st. Detour routes are in place. Please follow posted signage and the direction of traffic control personnel at all times when you're in the area. 100th Street will be closed between 95th Avenue and 97th Avenue until October 1st. All businesses will remain open and accessible at all times. The City of Fort St. John and Napit Industries thank you for your patience while we continue to improve our city. Here at TNT Communications, we are committed to your safety and the safety of our staff. We are open, so come check out our huge inventory of cell phones and accessories. Check our website at ttcom.ca for a complete listing of all our rental equipment, such as two-way radios, UTV rentals, truck boosters, installation, and so much more. Please respect the social distancing rules and guidelines. See TNT Communications at Fort St. John, your Bell source in the Peace.
Whoa, that boy looks amazing.
Oh, thanks.
So much smoother, so much hotter. It's perfect.
Well, I have been working out.
You know I'm talking about your car, right?
Yeah, totally.
Specializing in collision repair, Alaska Highway Auto Body offers high-quality work on any make or model. For the finest quality collision repair service, see Alaska Highway Auto Body. You bend them, they mend them. To book your estimate, call 250-785-3282.
Watch this show live on Facebook or download the podcast at energeticcity.ca.
Welcome back to Moose Talks. I'm Dub Craig. We're joined now by a pair of local musicians who are going to tell us a bit about what it's been like to be a local musician and an artist in general during the COVID-19 pandemic. I'm joined now by Naomi Shore and Joseph Bulte of Last Horse Standing. Good morning. Thanks for being on Moose Talks, guys.
Hey, good morning.
All right. Well, we'll start with you, Naomi, as I kind of know a bit about what you had set up before, but talk us through what your year was looking like before COVID-19. As I understand it, you had quite a significant tour planned where you were going to be visiting a lot of places that maybe you've even never been before, and that all got shut down at the end of March, didn't it?
Yeah. Just getting right into it. All my hopes and dreams in the toilet. I've like in tours for like 10 years. Mm-hmm. So I usually book. I'm kind of constantly living 6 to 8 months in the future. Just even when I'm on tour, I'm booking next. So over this epic Western Canada tour, I was going to go out by myself, just all the way to Kenora, Ontario, and back. Mm-hmm. And it was a lot of places I've been before, but it was also like a lot of house concerts and just nice, small, intimate shows. And then my kickoff, my first show was supposed to be March 16th. So it was like, I don't know, the 4 or 5 days leading up to that. I was like, well, maybe it's not as bad as we think it's going to be. And I held out to the last possible second before canceling, and then it just became clear that nobody's going anywhere. In fact, you're going to be locked in your house for weeks. Mm-hmm. So, yeah, that was the beginning of COVID for me.
No, it doesn't really matter, but did you cancel it or were you canceled? Or was it sort of kind of happening at the same time where venues were phoning or sending out emails to be like, you know what, we have to shut down. We can't host any shows. Sorry.
Yeah, it started like probably, I don't know, March 12th or something. I started getting a couple emails, kind of equal parts, people being like, we're happy to wait it out and see what happens, or like, and house concerts where people were like, well, you could still come to our house. And then equal parts, people being like, we have to close our venue right away.
Yeah.
And then, and then it was just like, by the time the date came to call her, I was like, well, at this point, I only have a third of my shows left, so I might as well cancel. Mm-hmm. And then the idea of like, just like feeling really irresponsible, like, and selfish by being like, I have my plans and I don't care about the safety of anyone else. So I had the responsible thing to do was to stay home.
I see. Well, same question to you, Joseph. I mean, you and Last Horse Standing, I imagine you had some shows, maybe even festivals booked over the summer. That came to a crashing halt, didn't it?
Yeah, we had some fun things on the schedule. We were going to play the Rose Prairie release show at the end of April or mid-April, something like that. That was going to be a pretty awesome thing. They were going to release a record. We were going to play that, and then we had the Peace Folk Festival in Hudson's Hope. And, again, these are just great shows that you look forward to all year. And then we were actually going to we were going to host a youth rock show to get some of the youth bands playing from town. And it all kind of, same sort of thing. It's sort of, some were canceled immediately, some were like hopeful. And then, as time went on, it was just like, okay, well, we should all just cancel them all. Mm-hmm. But it's definitely an emotional roller coaster. It was kind of like the best of time. Well, I say this quote came to mind. Like at first it was like the best of times and the worst of times, because we had done a couple of videos in February and we wanted to release them in February, but as it worked out, they weren't ready till mid-March. So those ended up getting like a lot of traction right away. But it quickly fizzled out. And it became the worst of times, and it still kind of is, right?
Mm-hmm. Absolutely. Well, and I'll put this question to both of you again. I mean, since then, you've both found ways to keep performing, right? You've done, like kind of streaming concerts. You're on Instagram playing kind of shows. So you're able to perform, not as much maybe, but you're still finding ways to play for people. This question, I apologize if it makes you uncomfortable, but Naomi, we'll start with you. Would you say you look to performing and gigging as an artist as a source of your income that disappeared, evaporated because of COVID-19?
Yeah, I mean, I teach music lessons over the winter at home just to kind of get me through. And then generally I'm touring from March until October, and that's my entire source of income. And then it's, like playing festivals and touring around and kind of living on it, but then banking money so that I can go record music, which is the most expensive part. But like that, I'm still paying off my record I released last year. So part of my touring this year was to finish paying off that record I made. So I think, and that's where it's like being a touring musician, it is just this vicious cycle. It's like a very break-even business, and you do it because you love it and you have to do it. You feel called to do it, but it's been a whole thing. And then, even staying home, I still can't teach lessons at my house. Like that's still not a thing. And that technology-wise technology is not on my side. I'm not gonna get hip with the times and set up 3 cameras to teach 7-year-olds piano lessons, because that's just sounds like more effort than reward. But and the live streams have been okay. It's like very weird to get nervous for a show, have a cocktail, put on your makeup. Like I've been trying to pretend like they're real shows, but then when it's over and you turn off the live stream, you're just alone again. Yeah, there's not just applause. There's no hugs. There's no compliments. There's no merch sales. Yeah. There's no. So, yeah, I've done a few live shows and like live streams, and they're okay, but it's no substitute.
Mm-hmm. Now, I mean, same question to you quickly, Joseph. I don't know your situation as well, but I mean, is this a source of income for you? Is it the source of income that you were depending on, looking forward to this summer to be able to tour and make some money as a gigging musician?
Well, for us in our band, we're kind of hobbyists. We're more of a local based thing. Mm-hmm. And, we do provide a service that we do charge for, and that helps us break even, with our band expenses and stuff.
Yeah.
So, we're not as dependent as, our friends that are professionals like Naomi, and we all have a handful of other friends that are professionals, and we really, our hearts go out to them, and a lot of respect for what they do. For us, it's, there is some lost income there for sure. Mm-hmm. And, it's a whole, like, the music industry's kind of under attack with the whole streaming thing and radio, thankfully, is one avenue for musicians to still get paid when their songs do get played. But yeah, it's just, the streaming thing is great in a way, but it's making our service more free. Mm-hmm. And so that's unfortunately another blow to people that are trying to make their living in this industry. And
agreed.
Yeah, so it's I don't know what to say except for that it's just kind of, it's sad, I guess, and I don't really know. It's just changed the industry, I guess, and I don't know. It's hard to see the light at the end of the tunnel in a way. Like, there are some shows that are starting to happen again a little bit, but it's very tentative. So,
okay.
Yeah.
Yeah, I mean, you answered kind of my next question for me, but I want to give you a chance to respond to that, Naomi. I mean, how concerned are you for the future of gigging artists like yourself, as Joseph alluded to, and even venues that put on shows for local artists and just artists in general? Do you think they can find a way to bounce back here, or is this sort of pandemic change the landscape so much that it's going to be different from now on? What do you think?
Yeah, that's the thing. I mean, the whole pandemic, the whole idea of, like, we all have to get comfortable with uncertainty, which for me is, like I said, I've been planning and plotting 6 months in the future for 10 years. So getting comfortable with uncertainty and the not knowing is really hard. And yeah, that even if we had a date in the future where I could book a tour, I have no idea what venues will still be around. House concert hosts, they're usually senior citizens. I don't know if they're going to be around. Like, it's really scary. So, and just looking at cities like Edmonton that are losing some of their biggest, longest running venues, even the Lido here, like, it's just so sad to drive by and see it closed all the time. And I talked to long ago about doing shows at the Lido, and he's like, I can follow all the COVID rules. We've got lots of space. There's lots of room. But I was like, I don't think anybody's going to come. I don't think I wouldn't feel comfortable going indoors to watch a show. We went to the Rolla Pub last weekend, and that was something else.
Yeah.
It was like,
if you've never been there, it's a very small room in there. So that's...
Yeah. But it felt good to go support Patty, because she's reopened and she had an artist from Prince George come and play. But yeah, it's just the uncertainty of it all. By the time I'm allowed to tour again, will I have, filled the void with something else and moved on? Because it's pretty hard to just sit in the grief and the unknowing of who I am. So, yeah, it's like,
Yeah.
should I go back to school? Should I get a real job? You know, like, I don't know how long I can wait. So, and I just haven't, I haven't felt a lot of creative motivation during this whole thing either. So that's hard.
Yeah, absolutely. All right, we're going to have to leave it there, guys, but I really appreciate you making time to talk to us today, especially about something tough like your livelihood and your creative livelihood in a lot of ways. So thank you so much for talking and being candid with us today. I really appreciate it.
Thanks, Deb.
Thanks, Deb.
All right,
Have a good one.
we'll be right back to wrap things up right here on Moose Talks.
There's nothing better than enjoying fresh produce in the fall. But what makes fresh produce even better? Fresh, local produce. The Fort St. John Farmers Market is open every Saturday until Thanksgiving at the Seniors Building on 100th Street. And they have a huge selection of fresh fruit and veggies and local meat vendors. While you're there, check out all of the crafts from our local vendors and so much more. Support our local farming community every Saturday from 9 until 3. For more, follow the Fort St. John Farmers Market on Facebook. Rips has been repairing footwear in the Peace area for over 40 years. We'll renew anything from high heels to Western boots. Remember, get your soul saved at Ribs Shoe Renew, located in the Co-op Mall on 8th Street, Dawson Creek. If you're looking for hassle-free internet services, call the Peace Region Internet Society today. With coverage throughout most of the Peace, PRIS can get you connected quickly without the hassle of contracts or bundles. Visit PRIS.ca or call 1-800-768-3311 for more information.
Hot, delicious, and only $6. Head to Quiznos for their toasty deal of the day where you can enjoy a 9-inch sub for just $6. It's a different sub each day, and since they're only $6, try them all. It doesn't get better tasting than Quiznos, beside Walmart.
Our community first. This is Moose Talks with Dub Craig on Moose FM. Join us next Friday at...
Our thanks again to our guest today, Dr. Jong Kim, the Acting Chief Medical Health Officer for Northern Health, and local musicians Naomi Shore and Joseph Bulte. Right as we were going to commercial there, I wanted to make sure we mention this. Naomi actually has a bit of a show she's playing in Prince George on the weekend. If you're interested in it and you want to follow along for anything that happens with these local artists, Naomi specifically, you can follow her page on Facebook or check out naomishore.ca. I know Last Horse Standing has a Facebook page as well. And if you can find it in your heart to help a local artist buy their CD, buy some merch at this time when they're unable to play, that'd be great. You'd be supporting them. And as you heard from both of those people, it's income. That's something they were hoping and depending on before this COVID-19 pandemic started. Anyway, that's it for Moose Talks today. You can watch this episode again on the Moose FM and energeticcity.ca Facebook pages shortly. You can also download the podcast at energeticcity.ca/Moose Talks. Adam Rayburn's the studio producer. I'm Dub Craig. Everybody stay dry.
Join us next Friday at 10 a.m. for another episode of Moose Talks, a weekly talk show about Fort St. John and the North Peace.
This is Moose Country. This is Moose Country. 100.1 Moose FM.